I know personally, I dealt with postpartum anxiety and I thought that I could exercise my way out of it. I thought I could eat my way out of it nutritionally, and I couldn't.
All right, so welcome everybody to another episode of the Jacque Show. We have Dr. Kim over here, and I'm so excited to bring you on. You've been able to help some of my patients. You've helped my wife with this whole pelvic floor topic, and not only helping them, but helping to re-educate me because we've only been taught a certain way. So thank you for being on the show, and I'm really excited to have you on here.
Yeah, thanks for inviting me. I could talk pelvic floor all day long. I love what I do. I love to educate. And so thanks again for inviting me on. I'm really excited.
Absolutely. So tell me a little bit about yourself. You know, obviously you're Dr. Kim. Who are you through and through? What's your practice called? Fill people in, give them the details here.
Yeah, so I'm practically an Arizona native. Been here for quite a while, graduated from ASU, go Devils. And I went to PT school, I guess it's 12 years ago now. How time flies when you're having fun, right?
Right.
So I am owner of Thrive Pelvic Health and Wellness. And then we also just launched our new Thrive Pediatrics
Awesome.
Earlier this year. Yeah. So we specialize in women's pelvic floor health, which could be such a large gamut. That could be anywhere from fertility struggles to pregnancy support, labor and birth prep, postpartum recovery, and then even menopause and what that transition looks like. So a wide variety of services that we provide for women.
Yeah, and I mean your knowledge. It's in terms of the service you offer a lot of things, but your knowledge, I mean, it fits every single one. Where some people they'll spread themselves out too thin. They'll know like a little bit over here, a little bit over there. You have this passion, and I mean, we met for coffee that one time. We got some coffee there, and like you could tell your passion was through it, and you wanted to help as many people as possible. And something that I want to allow my listeners to know too is when I say that you've worked with my patients, you've done virtual stuff with them where you're able to help patients in other states. So this isn't just you have to come to the practice. It's another leg of what you offer because not many people do what you do.
Yeah, I would say even whether it's virtual or when patients come to see me in the clinic, a good portion of those sessions are patient education. So that can be utilized wherever. And it's something that I really try and instill that in my patients so that they have that. They can use that from day one moving forward. So it's really, really helpful.
Yeah, I love that. Oh my gosh, I'm so excited. I know I said it already, but I'm so excited to go into this. In terms of like where your passion, where it kind of resonates through, I want to kind of give you the floor and fill us in like what do you want to talk about today, and just take it from there. And I'll throw my little things in here, you know, here or there if I have something to add, but I just want this to be really like a monologue coming from you and then the occasional dialogue. So take the floor. I'm here to support. Let's get this thing going.
Perfect. To start off, I feel like there are so many topics when it comes to pelvic floor. So it was really hard to narrow in on one. So if there's other topics that ever want to be covered, I am more than happy to talk about that. But today, what I wanted to talk about was fourth trimester. So postpartum. What is that? When do you start planning for that? So I came up with this fun little acronym. I like things to be easy to remember.
Yeah.
That's how I got through anatomy. So what I came up with, it was how to be P-paired for fourth trimester.
Okay.
So, and that's PEE. And what that stands for is we want to look at physically, how do you physically prepare for that? Environmentally, what are things around your home that you could be looking at, and emotionally. Now, when people come to Thrive, we do have a heavy focus on the physical aspect, but we also like to prepare and be aware of the emotional and then also the environmental impact that can have. And it's never too early or too late to start preparing for that. So anytime is a good time. So in regards to the environment, things that you want to be mindful of when you're preparing for that fourth trimester after birth is what are some things maybe around the home, whether that is a bookshelf, sharp objects, pool fence, locks, all of those sort of things. Sometimes I know here in Arizona, we have groups that will come and actually come to your house and go over that with you and give you suggestions to help make your home safer. Again, it's, those first few months when baby isn't really moving around or rolling or doing much, don't have to worry about it too much, but you want to be prepared, putting up a pool fence or maybe adding some locks, some high latch locks to your doors might take a little bit of time. I remember with my first, I think I was maybe doing something inside. My husband was doing something in the garage. And I think our son at the time, maybe 18, 19 months. And I remember we didn't have high latch locks on the doors. And I thought he was with him. He thought he was with me. All of a sudden I go out into the front yard and there he is in the front yard. I'm like, oh, okay, well, we're going to put some chimes on the doors. It's hard, like when they're little and you go to the restroom or you turn around, they're busy and they're fast. So something like that, I feel like would have been really helpful for us to have. So just knowing that that's something to look into so that you don't have to in one weekend try and replace or install something. So environmentally, that's something that I recommend looking into.
Perfect.
The emotional side of fourth trimester, those postpartum blues and postpartum depression is huge. And so I think it's really important for not only ourselves, but our partners, our family to know what are some of those signs and symptoms that maybe this isn't just those immediate baby blues. Maybe this is a little bit something more substantial, requiring additional support. So if things are lasting, if that sadness, that anxiety, that feeling of overwhelming is lasting more than about that 2-week time frame, that's when I recommend reaching out to a mental health provider. Again, it's one of those things that's much easier to have someone on board to have some of those recommendations than waiting. I know personally, I dealt with postpartum anxiety and I thought that I could exercise my way out of it. I thought I could eat my way out of it nutritionally, and I couldn't. It was something that I needed a little bit more support with. And so it's always nice to, again, have some of those numbers or know those signs ahead of time. So things like feeling extremely restless, crying a lot, feelings of maybe wanting to hurt your baby, hurt yourself, no energy. And this isn't just like, oh my gosh, I haven't had sleep, I'm just feeling a little bit fatigued. This is like something that's really noticeable. And that's why, again, it's really important for you for you to have this information, but also your partner, your spouse, those people in your community, your family ahead of time so that they know and can recognize this and give you the support that you need. Maybe withdrawing, sleeping too much or not enough. So those are all signs that maybe there's something else a little bit more going on and getting support for that. So now I've briefly talked about the environment and the emotional aspect, but now my favorite thing that I'm very extremely passionate about is the physical aspect of recovery. So there's a few different ideas out there. There's, the 40 days. There's a book out there, the first 40 days postpartum. There's also the notion of the 5-5-5, which is 5 days in the bed, 5 days near the bed, 5 days, I think, in the room. So it's really trying to let your body rest and recover. I love that idea. I think that sounds fantastic. But for a portion of the population, that might not always be feasible, especially if you have a toddler. Maybe you don't have as much family support. So the biggest thing is rest. Make sure that you're hydrating yourself. Make sure you're fueling yourself with good nutrition, whole foods, and I'm sure you can attest to that. Wanting to have those warm foods that are easy to digest. Really limit some of those processed foods, the high sugar, caffeine. I know it's easy. You want to caffeine or your way out of poor sleep, but that's not unfortunately going to help and solve the problem. You do your best. The most important thing is listen to your body. Your body will tell you if you overdo it. The signs that I always educate my patients with, if you are overdoing it, you might have some abdominal or pelvic floor cramping. You might also have a return of the lochia. So the lochia is the vaginal discharge where your body is healing from where the placenta came from. And so you want that transition, it'll start out kind of bright red, it'll transition to a light pink, and then maybe even like a brown. So you want it to have that continuum of something dry, like blood drying up almost. If you overdo it, you might have a return of that bright red. And so that's another sign like, okay, hey, where can I maybe modify things or get additional support to come in and help with that? In regards to pain, how can you physically manage pain? And this is for whether you've had a vaginal birth or a cesarean birth. One tool, one modality I feel that is so underutilized is ice. Have that ahead of time. Make maybe some padsicles, have some gel packs or frozen peas. You can apply that to the base of the pelvic floor externally or the perineum externally. You can also place that on the actual incision. Always have a little bit of a barrier there. You don't want to freeze
yourself out. Yeah.
Yeah. It won't feel too amazing. But even just doing that for, 10, 15 minutes a few times a day can really help with pain management and swelling. That is definitely I feel like an underutilized tool. And it's easy. It's easy to have around. The other thing, one of the topics that I get asked a lot about in regards to postpartum is to wrap. Should I wrap my abdominal wall? Should I get a corset or support? And I tell my patients, it depends. I'm not, an absolute no, never, but because there are some cases when you might need a little bit of support. No. I ultimately want my patients for their body, those muscles of the deep core, to come back on board and give you that stability. But there's, those first few weeks, that abdominal wall, pelvic floor, you might need a little bit of support. And that can vary. Sometimes I've had people wear almost like a high-waisted yoga pant that has a little bit of compression. Sure. Sometimes that's just enough support. Mm-hmm. Other times you might need something a little bit more supportive through the midsection, but do what feels best. I don't want you to be wearing it 24/7. I don't want you to be needing to sleep in it, but maybe you have to take your newborn to the pediatrician or to a doctor's appointment, and you might need a little bit of support, or you have to go to the grocery store. That's okay. If you need to use it to get through the day, and then you're doing some exercises to help wake that system back up, sure, that's okay. So it really depends. If you do choose to wear a wrap and you need to use that wrap or support for a period of time, be mindful of vaginal pressure or any sort of prolapse type symptoms. So just briefly, prolapse is when the organs, typically the bladder, the uterus, or rectum, are falling into the opening of the vaginal canal. And so you might see something, you might feel like you have symptoms might feel like you're sitting on like maybe a softball, or that there's a full tampon that's not fully inserted. Those could all be potential symptoms, but if you're using a wrap and it's creating this pressure from the abdominal wall, it might be too much for the pelvic floor. So just be mindful of that. I tell my patients to be mindful of that if they're needing to use that. And then another question that I typically get, and I think this might have been one that was posted or asked, was when can I get back to exercise? When can I get back to movement? Those first couple weeks, I mean, no, I don't want you going out running a marathon or returning to CrossFit, but I want you to move. I always, those first couple weeks, even something simple as pelvic tilt or bridges, think about those everyday movements that you're doing just to get, roll in bed or get up and down from the toilet. I'm not having you do heavy weights, but just move your body. Clams, those sideline clams or pelvic tilts, like I said, bridges, those first couple weeks are okay to do. Maybe you're doing just 5 or 10 a couple times a day, as long as you're not having some of the red flags. So again, I have another fun acronym.
There you go. Let's do it. Let's hear it.
Yes. The acronym for like the signs and symptoms to be mindful of is PUPA.
Okay.
Kind of a fun one now. PUPA.
Yeah.
PUPA. So pain, if there's any urinary or fecal leaks, if there's any pressure, like prolapse that I talked about, or abdominal doming. So any signs of that diastasis recti. So those are all the things, like when you are ready and choosing to go back to movement or exercise, I want you to always keep those 4 things in mind, and that will help guide you. So that will let you know, is this movement, is this exercise okay for my body to handle right now? So also another thing that I like those first couple weeks is just doing a small little walk. And again, it might just be to the end of your driveway, but getting outside, getting some sunshine, being out in nature is so nourishing for our minds and our bodies. So again, you might have to be with your spouse or hold on to someone, because depending on how the pregnancy and your labor went, or even just you're sitting outside, can also be extremely nourishing. So don't forget to get outdoors. After those first couple weeks, if you're feeling good, your lochia is starting again to transition into those lighter stages, your body's healing, then you can, go for a little bit longer walk. Maybe you're adding a little bit of weight to some of those exercises, which could be your baby.
Mm-hmm.
That might be something where you're holding, or you're wearing your baby, and maybe I'm doing again a couple of squats. You're doing movement throughout the day, and you're going to be, with your baby. And this goes, I would say, for a uncomplicated birth. There are going to be, unfortunately, those births where maybe you have a 3rd or 4th degree tear, or there was more involved, there was more trauma. Okay, that might slow you down a little bit as far as, your recovery time, or might make it a little bit longer, but keep that PUPA in mind when you're recovering.
That's exactly what I was thinking. That the PUPA analogy is great, because even from a female standpoint, but then also I know, and it's unfortunate, but a lot of men are like, you need to get back to the gym. You need to start working out. You need to start doing this. And so a lot of women through that 4th trimester, whether it's the moody blues and you start feeling that way, and there's so much pressure on a new mom that they have that fear of failure. And so if the husband's like, hey, you need to drop the weight, first off, that's a pretty dysfunctional relationship. But when you know the PUPA, I'm gonna laugh every time I say that. But when you know pupa, you know what your limitations are. So you can be like, listen, like this is science. This is real stuff. Like I appreciate your concern and you want me to get to movement, but I have pressure right now and I can't do those certain movements or, any of those things. So it gives you those parameters to make sure that, yeah, don't be lazy and be a couch potato, but use that as a gauge as to how much you're able to do. And then work each week. If you can do a little bit more, and do a little bit more, but slow and steady always wins the race.
Absolutely. Could not agree with you more. And I think too, you hit the nail on the head. There's such a huge pressure that we instill on ourselves and from society that, okay, I need to get back into my pre-pregnancy shorts. I need to get back into the gym quickly. And fortunately, I see those moms in the clinic and they're setting themselves back. They're coming in with prolapse is a big one that I see when we return too quickly. There is nothing that we can do to speed recovery up. It's cell turnover, it's our natural body's way of healing. That takes time. But there are things that we can do to slow it down. And that's inflammation, that's stress, that's not fueling your body, that's pushing it too much. So slow and steady wins the race here. Listening to your body and what you're able to do might be dependent on what your day or your night was. So if maybe your toddler is sick, or maybe the day before you did a load of laundry. So maybe you worked out in the morning versus the evening. So always that'll look different. And so again, keep those guidelines in mind. And if you are doing an exercise, if you're doing dishes or mopping the floor and you're having pain, vaginal pressure, urinary or fecal incontinence or leaks, or your abdomen, you can't keep good core support, that means it's too much for your body. Maybe you have to sit and fold laundry, or maybe you have family or friends come and help you with the chores. That's another thing that I talk to my prenatal patients about is people want to come. They want to come and help you. They want to see the baby, all of that. They want to help you with your community. And sometimes it's just nice to hold and be with your baby. And it is okay for you to have your friend come over and do your dishes or play with your toddler.
Yep.
That is okay. And it's okay for you to hold your baby and say, no, I'll take this. Can you help with something else?
Yeah, don't be afraid to ask for help, which again does the whole fear of failure thing. Like a lot of new moms are afraid to ask for help, whether it's from your husband or if you do have a toddler. Like Hoyt, our son, he was a great little helper. Like he would grab diapers or wipes, or like he just wanted to help. It's just, to me, that's human nature. That's how we're kind of built and wired. So don't be afraid to. I mean, they're gonna see the little bundle of joy. They might want to hold him or her and have a good experience, but don't be afraid to ask.
Yep, absolutely. So around that 6 to 8 week postpartum, if you've had a cesarean, you can start to do some scar mobilization, maybe doing a little bit of gentle power walking. And again, don't go and do like a 30, 35 minute. Maybe you're doing a slow walk and then a little bit faster for about 5 minutes and see how your body feels. Really hard when you feel great. You're like, oh, I feel amazing. I'm going to do this. And then later on that night or even the next morning, you're toast. So
I see that all the time. That's why I'm laughing.
Yeah. So as in regards to returning to running, it depends on what you were doing prior to getting pregnant. How was the pregnancy, your birth, labor, all of that. But typically, if you have been running before, pregnancy was good and you were active and labor was, quote unquote, uncomplicated, you can, start to do some light jogs around that 3-month time frame. But again, keeping those basics, that pupa that we talked about, keeping those in mind. Yes. Now that's going to be stuck in your head.
Yep. Forever. And it's a good thing.
right?
Yep. I
We
talk
want
about
them
poop and poopa.
you got it.
Yeah.
So when I have patients come in or reach out for postpartum recovery and return to exercise, whether in person or virtually, we talk through and go through a series of exercises and movements that they need to be able to do to safely return to running. So it's kind of like a checklist of, okay, I want you to be able to do X, Y, Z without any symptoms. Okay, now you can start to return to running.
Yeah, it's good to have that
Um,
checklist too, where it's like you lay the groundwork. If you can't do this yet, you can't run before you learn to walk. You can't walk before you learn how to pick yourself up. Like if you do things backwards or too quickly, that's when you're going to set yourself back. And again, slow and steady wins the race every single time on this stuff.
yeah, absolutely. Just for a recap, it's never too early or late to start planning for that fourth trimester, and reach out to your community. Remember to think about how to pee pair for fourth trimester. We want to look at physically, emotionally, and environmentally. And then, of course, our favorite safe movement analogy is pupa. So that's kind of in a nutshell, a lot of the stuff that I talk about with my clients about fourth trimester support and preparation. But I think there were a few other questions that were asked from
Yeah,
social media.
on the gram, on the Instagrams. But
Yeah.
but I don't know how you condensed that all down as well as you did. You did a great job with it. There's so much information on fourth trimester. Like you hit every one like right on the head. And I think the good thing is it's going to get people to start thinking differently. And when they think differently, they know that more is out there for them. They know that there's more than one way to be able to recover. And that's good because this stuff isn't typically talked about. And that was going to be the first question we got there is this a normal thing that, say, your OB is able to do or help you with?
So it kind of depends on your provider. Some providers, I would say, unfortunately, very few are making that recommendation to a pelvic floor physical therapist postpartum. Oftentimes, their lens is also a little bit different. They're making sure that you are physically healed and recovered after birth. Are the sutures healing well? Is the uterus, coming back down into the pelvis? Those sort of things. But they might be like asking some of those questions on an intake form. But if they're not addressing leakage, prolapse, oftentimes they're probably at that 6 week. I know my 6 week follow up, the last thing on my mind was sex. So I doubt that they're really, talking about that. And
Sure.
so sometimes you don't know that there's an issue until you start getting back into exercise and some of those daily things that we're
Yeah.
doing. So it might not, unfortunately, be addressed, but you can reach out. I'm always open. Just on our website, you can contact us there, leave me a message, or directly contact me via Instagram at Thrive Pelvic Health. You can ask those questions. I will help to give you as much, education, but maybe it's referring you to someone in your area, or maybe, I'm here. So I want that to be a reference of support and education. So that is always open.
Yeah, and I mean, you make phenomenal content too. You've been really diving into like the Reels game. It's been taking over my feed, which I love. And there's so much free education on your page. So, if they want to directly ask you a question, cool. But also make sure you don't just look at the post of the day that she made. Go through. She may have already addressed this because, again, you go into a lot of detail, and it may just be something as simple as like the next question, or like kegels the only way for you to fix your pelvic floor. Take that one.
No, no. I think it's an old wives' tale of just do 100 kegels a day. I actually had someone come in not too long ago that was pregnant, that her advice that she was given to prep was 100 kegels a day. I'm like, what? No. Kegels or a pelvic floor contraction can be good for some if you need strengthening.
Mhm.
And if you have been taught to do it correctly. Most people are not doing Kegels or a pelvic floor contraction correctly. It's kind of like, I always give this example. It's like if you came to me and were like, okay, Dr. Kim, I want to work on my bicep. What can I do? And I'm like, okay, well, I want you to do, what I want you to do is I want you to lift your arm up. And I don't show you what I'm talking about. And I don't watch you do what I'm talking about. And you're at home lifting your arm up to the
Working your
side.
bicep. Yep.
Yep. And you're like, well, why isn't my bicep getting any stronger? Because you're doing the wrong thing. I find that often, if you're holding your breath or sucking in or engaging your glutes to do a Kegel, you're doing it incorrectly. If that's the right thing for you to do. Sometimes, and I find this probably a little bit more often, is that pelvic floor is too tight or hypertonic. And so let's take our hamstrings, for example. If you have really tight hamstrings, well, I don't want to strengthen them in that restricted, limited range of motion. Right. They're not going to work as well. I want to give them a good length first, and then teach the body how to utilize that length in a functional way to help with your symptoms. And so the same thing goes with pelvic floor. Sometimes pelvic floor needs a little bit of release work, and maybe that's with certain yoga poses, breath work, or even some external or internal pelvic floor manual therapy or mobilization. So I always recommend, before you start an exercise program, to go and see a pelvic floor therapist first. I mean, you see, like if you purchase a home exercise program or some sort of like CD, or I guess I just said CD. They don't have CDs.
I love it.
You know what I mean? Like, or some sort of exercise or wellness program, like online, like there's a little disclaimer, right? It says, please, make sure you check with a provider before you start this plan. The same thing goes for Kegels. Please check with a provider, a specialist, before you start that plan to make sure that that's the right thing for you to do.
Yeah, and going back and forth between the too tight, too loose, like being steeped in this stuff and working with infertility, like I didn't even know that they could be too tight. So I was the naive one, and then Megan was like, "Hey, I'm going to go to a pelvic PT," and to me, I'm like, "What the hell is that?" And she explained. I'm like, "Why didn't I know about that? It makes so much sense. It makes less sense that it's not a normal portal of exit post pregnancy, that like you should be required to see a pelvic PT, because it sets you up for success in recovery. But also, if and when you have a second child or a third child, you'll have a healthier, happier, easier pregnancy, and then you'll know how to retrain after. So it just makes sense. Like before starting a workout routine, like don't just go ham and be like, well, I saw this one video, this one person said I should do it this way, but like seek an expert in this, which is you. That's why I'm bringing you on here. Seek the proper advice from a proper professional, so that way you know what you're doing, so you're not screwing yourself up. Because if you keep over tightening, you can hurt yourself, and that's not what anybody really wants. If a client is out there right now and they're like, you know what, I think I want to reach out, but I'm just curious, do I have one that's too tight or do I have one that's too loose? Do they have certain symptoms associated, or are there crossover symptoms with both?
Yeah, there's a little bit of crossover. That's what makes it kind of tough. If you're having leaks, we often think, oh, I'm too weak or too loose. I don't have enough strength. But if the tissues don't have enough give or shock absorbing, when we go to cough, when we go to laugh, when we go to run or play with our kids, if the bladder, it needs to be able to move when we cough. But if these muscles are too stiff, it's like jumping on a stiff trampoline. There's not enough give. So it could be either one. Same thing with painful intercourse. If the muscles are too tight, that could be contributing to pain with intercourse. However, if your bladder is dropped down and you have a cystocele or a bladder prolapse, you could also be getting some discomfort because there's not enough space.
Mm-hmm.
And that might feel like your partner might feel like they're hitting something or not. It feels different. So there is a lot of crossover. So it's not a cookie cutter symptoms. It's not a cookie cutter fix. It's really making sure like, this is what's going on. This is my body. It's different from, Sally Joe's and Mary Beth. Like every body is different. So again, I can't stress it enough, the importance of seeking professional help before starting, pelvic floor exercises or kegels. So
yeah. And that's exactly why I posed that question, because and for me, like my mind goes to adrenals, where like the adrenals can have like crossover symptoms, but it's something, again, seeking professional help, because you can't pinpoint what it is. Not like as a client, like on your own, you can't necessarily pinpoint it. You need to go to an expert to be like, hey, I've got these symptoms. Can you assess me and find my underlying cause as to why this is happening? So you're technically a doctor of cause and really a doctor of preparation as well, where you teach women, where I'm so excited. Like, and we can do this on another podcast, but like, I am so pumped up about hearing about the pediatric side of things. Like, I think that's like, my mind is blown. Like, this stuff needs to be out there. It needs to be in like, your high school sex ed classes or just the information. Like, hey, if you have a PCP, make sure you check out a pelvic floor PT as well, because you want to make sure that as you're growing and developing, you might as well catch them as soon as you can. So that way, 10, 15, 20 years down the line, you're not looking at a problem that you've been creating this entire time. You can nip it in the bud back then, right? That's where my mind goes. Like, let's be as preventative as we can. So whether you're an adult that's seeking help from Dr. Kim, or, you have a 12-year-old or a 13-year-old or something like that, like, this is all stuff that could then be passed on to them so that they know this and they can have a better chance than we did, because you may just be learning about this.
It's speaking to the choir.
I know. I get fired up. I get so passionate about this because, again, like my whole mission at some point in life, I'm going to try to hijack the entire education system and like put this stuff into play and make this mandatory versus like some stupid class that doesn't mean anything like this, or just revitalize the health class. Like, health class to me was like, this is a bicep, this is a tricep, good, go work out. Like, but what? Yeah. I don't know.
No. It's good that you're passionate. Yeah,
I'm very passionate. Yeah. Cause I mean, like I said, you help Megan, you help patients of mine. And like, I see the work that you do, and it's so highly needed. And I usually end with this, and you kind of said it already, but where can people reach out to you? So it's just Thrive Pelvic Health on Instagram, right?
Yep. And then we have our website, thrivepelvichealth.com. So yeah, I want to be a resource. There's a lot of, like you said, I have a lot of content, a variety of education that I've been building on my Instagram account. If there are topics, if there's special topics that people want to know about or learn about, please, message me, let me know. I will get it done. I
love it. Thanks so much again, Doc, for being on today. We'll probably end up, like I said, doing another podcast because I could talk to you for hours. But yeah, we're going to put out all your information stuff in the show notes as well. So if you're listening to this, you can go down and click the link and go and find Dr. Kim. I do strongly encourage, go on Instagram, see the content, see who she is, because you're genuine through and through on who you are in person as well as on Instagram, which is one of my missions, is to bring authentic people onto this show. So I would highly encourage you to do this and enjoy, because it's going to blow your mind, I promise.
Well, thanks so much. Like I said, I could talk pelvic health all day long. So anytime you want to have me back, I'll be ready and willing.